SCDN. We don't do the news in the same old way because it's not the same old world.
All my friends, Subject County Daily News. Today we are talking to Kaleigh Moore, who is a board certified nurse practitioner, and we're going to talk about telehealth medicine, new mother issues, and some very interesting details about bottle feeding, some of the do's and don'ts. So, Kaleigh, we're going to bring on right now. Hello, Kaleigh.
Hey, Mark. Hey, everyone.
So tell us a little bit about your practice and a little bit about yourself.
Okay. Well, my name is Kaleigh Moore. I'm a board certified family nurse practitioner. I was board certified 3 years ago and have been practicing in family practice locally. I've noticed over the last year kind of some disparities locally that need addressed. And after having twins, one became pretty apparent. And one of those is nursing mothers and postpartum families, and just basic primary care needs in the area. It takes a pretty good while to get in with some of these primary care doctors locally, and sometimes your needs just can't wait that long. So I have decided to start out as a telehealth practice, addressing some of these needs, and eventually hope to progress into a brick and mortar site.
So what are your three main areas of expertise? I know you kind of touched on them a little bit, but just
Yeah.
kind of break it down a little for us.
Yeah, so my nursing background was in ICU and critical care. I spent 6 years there as a nurse, and when I graduated nursing school, I transitioned into the family practice role as an advanced practice registered nurse. I don't know that we would call it a specialty, but a lot of the needs that I address are just basic generic healthcare needs, high blood pressure, poison ivy, diabetes management, um, anxiety and depression. So that would be one of the main areas. The second area would be women's health. My goal is not to replace an OBGYN or a pediatrician or even your healthcare staff at the hospital. But there are some gaps that happen in care whenever women experience childbirth and go throughout their pregnancies. And I'm not sure if it's just the area that we're in. Being pretty rural, we don't have a lot of specialty areas. But my goal is to help address some of these needs, such as help with breastfeeding, help with postpartum anxiety and depression, pace feeding with bottle feeding, weaning from breastfeeding. There's so many topics involved with that we can address and help bridge those gaps in care. And then the third would be, mental health. I am partnering with Rob Deckert, who is a local licensed mental health counselor. He just started here a few months ago. He moved from Michigan. So my goal is to help women with postpartum anxiety and depression and their families, and get them that care that they need in this area where there's a definite lack of mental health care.
So tell me about telehealth and why you think that it's very trendy in some of the larger cities, but it's not really much available around here. Why is telehealth getting so popular with folks?
Yeah, I think we all know over the last couple of years, this COVID pandemic has changed a lot of our lives, and it's really changed the world, and it's changed healthcare. Whenever COVID started, I was just starting as a nurse practitioner, and we were seeing patients in office, and then all of a sudden, a light switch just went off, and everything became telehealth. So we've really had to adapt our assessments, our assessment skills, and how we learn, to be healthcare providers to adapt around telehealth. I think people have gotten used to that over the last couple of years. It became more convenient. It became more cost effective. Insurance companies had to adjust their billing, and hospitals had to adjust their whole EMR systems around telehealth. And now that that change has taken place, I think it's going to be here to stay. So that is something I wanted to kind of jump in on and help provide care locally where the need is, with a cost effective but still, up to date way.
There are so many people, myself included, that have a lot of anxiety around going to see the doctor and everything that comes with it. And so telehealth really brings that to where it's more comfortable for the patient. So the patient, I believe, can be more honest and open, discussing, kind of what's going on. And as far as the practitioner, what are some of the main benefits that you see by using telehealth?
Yeah, one of the populations I'm addressing is new mothers, and as a mom, my twins are just a year old in December, so getting out of the house is a chore in itself. So to be able to, get healthcare from your own home, if your kids are screaming in the background or tugging at your leg, you're not having to drag them in to your appointment with you. And everyone's always going to be more comfortable addressing things from their home. You may not have to, or you may not even be able to get out of bed and get dressed that day. A lot of elderly people are shut-ins in this area and are not able to get out to seek care just for basic needs. So I think
Right.
it's becoming a more convenient and more practical option for many people.
So we have your website up on the screen for folks. If during this live stream you have any questions, feel free to put those in the comments, and we'll spring them on Kaleigh and see what she has to say. When you go to that website, this is what you'll see. Tell us a little bit about, kind of navigate us a little bit here through your website.
Yeah, so when you go to the website, the very first page is just going to tell a basic overview of the practice. Originally, when I started the practice, I was focusing on the pregnancy and postpartum aspect of it. I kind of started spreading the word, and then I had people approach me and wanted other needs, basic primary care needs. And there really wasn't any reason that I couldn't help them with that. And the demand was, kind of overwhelming for just starting out. So I decided to go ahead and reach out and offer some of those primary care needs as well. So this is the first page. I have a couple tabs at the top. One of them is just going to be basic information about me, where I went to school, I'm from here, just kind of giving my background. The next tab is my OBGYN collaborator. So the state of Ohio requires nurse practitioners to have a collaborating physician. And I was very lucky that Sarah Gerlach, and a board certified OBGYN, has agreed to collaborate with my practice, which is really beneficial for these pregnancy and postpartum issues. The next tab over is a list of my services as far as cost, membership options that I'm offering. And then the next tab is just how to contact me. I am kind of a one-man show. So if you call, you're going to get to talk to me. I'm very open to answering any questions, if you have a need, if it's something that I can help, if my practice is going to be applicable to you. I'm very open and trying to keep your options open as well as far as contacting me. You can text that number, you can call, you can send an email, you can Facebook message me. I'm pretty responsive in time. And then on the top of that left screen too, you'll also see an option for a patient portal. So I do have an EMR system that has a patient portal where you can self-schedule and you can send messages through patient portal, get, reminders for your appointments. I do have some availability as far as hours wise posted there, but I am trying to be pretty flexible. I'm a mom myself, and I know that sometimes you work around work schedules and ball practices, and there's no reason I can't take 15 minutes out of my evening to help address your needs if that's the time that you're available.
So your website has a patient portal. That's big time. So you
Yeah.
must have a big time web developer, right?
No, I actually built it all myself. So website, I did purchase an EMR and portal, but the website and everything on there, I kind of did in my, I like to say free time, but there is no such thing as free time.
No,
I did it with a couple of
very
kids
good.
pulling at my legs. So if you see any typos, I probably need to fix those. But
Uh, we've got a question that came in. Let's take a look and see um, who is a good candidate for your telehealth services. That's a good question.
yeah, so really anyone is a good candidate. The state of Ohio, we do have to follow, nurse practice laws. I can see anyone that is currently located in the state of Ohio. So it doesn't really matter what state you live in. You can live in Kentucky, and as long as you are located in Ohio at the time of your appointment, you're heading to Walmart and want to hop on, that's allowed. It's also a really good option for people. I know a lot of our older folks travel back and forth to Florida, or even their families travel back and forth to different states for the winter. And, if they come home and wake up with poison ivy and, they're not going to go establish a new primary care doctor here. And their only other option is urgent care, which, can be expensive for some.
Right.
So just basic needs, they come home and forget they left their blood pressure medicine, or they're visiting and, forgot their inhaler, just any basic needs that may need met. I can see
So
someone.
that goes
Yeah,
really well with, I don't mean to cut you off
no,
there, but
you're
this
fine.
came in. This kind of goes with where you're at here. Are you available to see locals only, or is this available to anyone in Ohio? Great question.
Yeah, the benefit of telehealth is, you can
And you
be.
were alluding to that you for anybody in Ohio, of course.
Yeah, anyone in Ohio, as long as as long as you are able to log on to our appointment or take the phone call, in the state of Ohio, I can see anyone. I can see someone in Cleveland just as easy as I can see someone that lives next door. It's a virtual office if you think of it. I do want to mention though that with telehealth, there are some aspects that do kind of limit our practice. I'm not one, I don't know if any of my current patients are watching this, but I'm not one just to kind of blindly treat something. So, if you think you have an ear infection and I'm not able to look in your ear, I'm probably not the best option for you. And I'll tell you that if you schedule and, I can't help you. But I do want to just make it clear that, this is all telehealth. I am offering some home visit options, but those will be limited to local patients. So
Home visit, house calls, telehealth. Holy
yeah,
cow!
trying to bring
We're
back that
literally
home.
going. Yeah, I mean, we're going from the 1800s when the doctor always came to the house to the 21st century where you can have, the comfort just like you and I are talking right now. Could just as well be, a healthcare appointment. Um,
Yeah.
can a person transfer from their current brick and mortar primary caregiver to you? And if so, what's that process like?
Yeah. I mean, it depends on the need. As far as being someone's complete primary care doctor at this point, I'm not sure that is the best thorough option. As far as I can't listen to your lungs, I can't look in your ears via telehealth. If you have an acute need or your primary care doctor, you can't get into them for months at a time, or say, you're young and you don't have a lot of health issues, then yes, that would probably be an option. My goal is to get busy enough this way that I have enough need to start a brick and mortar practice. I just want that to be something that's both practical for my patients and for myself. So if it does come to that point where I'm having enough demand, I'm definitely interested in opening a brick and mortar. I just got to get to that point.
So it just has to happen organically.
Yes. Yeah. I don't want to try to force anything on people. My goal is basically to be here to meet needs. So if the need arises, then that's something that I'll step up to do. Yes.
So now let's talk about your passion.
Yeah.
Um, tell me about the needs of nursing mothers. What are
Yeah.
some of the challenges that they have that seem to kind of fall through the cracks in the system as it is now?
Yeah, so, this was a need that I didn't really know existed until I went through that situation. And I was kind of, I don't want to say ashamed in myself, but, as a healthcare provider, it's just something that we're not taught in school. I saw a statistic the other day that 64% of medical students or, nurse practitioners, doctors reported that they had zero education on breastfeeding in their programs, which was true for mine. It's mentioned and it's encouraged, but they don't really teach you how to do it. So I found myself pregnant with twins last summer, and I was, scared to death, honestly, because I had no idea. I don't want to say I had no idea what I was doing, but I knew I wanted to breastfeed them, and I had no idea how I was going to do it. I failed with my first child because I didn't really have the education I needed. And studies are showing that if women have mothers, parents have a breastfeeding counselor or someone to walk them through it, their success rate increases by 181% the first 12 weeks. So when I found myself in this situation, I just started researching. I started doing continuing education hours, all of these new seminars. I'm a member of IABLE, which is an Institute of Breastfeeding and Lactation Education. I'm now a member of the Academy of Breastfeeding Medicine. I really did a deep dive and to help make me successful at this. So, along the way, I found that, women aren't being measured correctly for flange sizes for their pumps, if they're pumping. And I know a lot of us without maternity leave are going back to work. I went back at 5 weeks postpartum with the twins. So I had to learn to pump. Only 3% of women use the flange sizes that the insurance company sends you with your breast pump. So if you're not measuring, it's going to affect your milk supply. I was never taught how to increase my supply, decrease my supply, how to store breast milk. This is all stuff I had to learn on my own. And I found myself kind of Googling things, and everyone knows Google doesn't always come up with the best options. So I wanted to be that person that is offering medical-based, evidence-based research and things that we know works to help breastfeeding moms. And I'm not at all, decreasing the ability of our local providers and maternity providers here, because they're great when you're there. But when you're discharged home, you don't have that extra help. It's not easy just to take your baby and go back to the hospital twice a week to see a lactation consultant. So this is something I just wanted to be available to help mothers. And I know I would have paid a pretty penny to have someone come in and help me those first few weeks learn kind of what I was doing. And it's an investment really in your healthcare. You invest early, you're going to, one, it has a 5% decrease in mortality overall in a breastfed infant for any reason. And you're going to save on formula, you're going to save on bottles, you're going to save on healthcare costs, sicknesses. So it's a struggle in the beginning, and it is an investment, but it's worth it.
So, when it comes to, a lot of people have questions and they don't really have an answer, and they try to WebMD it and get all freaked out. But when it talk about volume and, how much is the baby, getting, and is it enough? And then in a situation like you with twins, is there enough to go around, basically, in layman's terms? So, talk a little bit about that, and then also for folks that choose to use formula, talk about the formula. And we spoke earlier about, you were talking about the way the bottles feed the infant, and that was very interesting that you talked about. So I'd like to kind of draw that out for the folks too.
Yeah. So kind of going back to the first question, learning to feed two babies and, your body adjusting to that is something that, it does have to be manipulated. Breastfeeding is all about supply and demand, moving milk. The more milk you move, the more milk you make. So it is a commitment, being home the first few weeks, as long as we're establishing your milk supply by 6 weeks, your body kind of starts to recognize that as normal. And after that first 6-week period, it's going to continue making that. So as far as the bottle feeding goes, I want to start out by saying that I am not one that I'm not going to push someone to breastfeed. I want people to be aware of the benefits of it, but if it's not something that's for you, then that's fine. And there's other things that we can work on. I do want to mention though, any amount of breastfeeding is beneficial for your baby. There's even studies that are showing that if you're expressing colostrum at your delivery, and the only thing that happens is your baby's oral care is completed with colostrum, a swab of their mouth, it helps to establish their gut biome and all the good bacteria and everything in their gut. So I don't want people to think that it's all or nothing. Any amount of breastfeeding is great. But for those that do choose to formula feed, there are a lot of options. Pace feeding is something that I talked about earlier. When a baby nurses, which is kind of its natural instinct, it's not getting that immediate gratification of a full bottle of milk. It's kind of working for that. And that's why you're seeing a lot of babies, what they're thinking of falling asleep at the breast. But women have multiple letdowns during breastfeeding. And when you're giving a baby a bottle and you're letting gravity do the work, they're getting that instant gratification. So they tend to suck down a bottle very quickly. It's causing GI issues. It's causing reflux. So something that I've done a lot of research on is pace feeding, and about, taking 15 to 20 minutes for that baby to finish the bottle. Just something as simple as that can help change, a baby being on medication for reflux or spitting up, frequent spitting up, not sleeping well, still feeling unsatisfied after getting a bottle. Most of the time they're just getting it too quickly. So there's a lot of issues and a lot of things that go into breastfeeding and bottle feeding. It's not just a pass or fail type of thing.
You have really, really done your research. I would feel very comfortable recommending anybody to come and see you in our conversations that we have, and now here live for everybody to see. Let's talk a little bit about the very real postpartum depression situation.
Yeah, so something that I've found locally in my current family practice is I've been having issues getting people referrals for psychiatric care. A lot of our local places are great options for people, but not all of them accept private insurance. So it's really hard to find care for someone seeking mental health issues that has private insurance. Luckily, we've just been blessed with Rob Decker's presence that I talked about kind of earlier, a licensed mental health counselor that's seeing patients here in New Boston. He's seeing both virtual and in-person patients, and he has a great deal of experience behind him. So we've kind of partnered up, and anyone that I've been seeing with postpartum issues, anxiety, depression, they really don't know who to reach out to. I remember after I had my first child, I was having some issues with some like paranoia or postpartum OCD, and I sent my OBGYN a message, and she wanted me to see my primary doctor, which was great, but it was 4 weeks before my primary care doctor had an appointment available. And the first line treatment for any type of, anxiety, depression, OCD is cognitive behavioral therapy, which is mental health counseling. And there just is a very big lack of that in our area. So Rob and I kind of teamed up to both hit the medication treatment portion and the cognitive behavioral therapy portion of that, to meet these mothers' needs that are suffering with postpartum anxiety and depression. And good thing about Rob too is he does accept private insurance, which is hard to find in this area. So
That's incredible. And you've set up a network, so you have the resources, not only with your own capacity, but if you find something that, you may have a network that
yeah.
can help folks so they're not just left, that didn't work. What do I do?
Right. A big issue I had when I had the twins was one of mine had some oral tethers, which is like what is a lip tie or tongue tie or cheek tie. And the only reason I knew is because I had two babies I was nursing, and one of them was doing okay. He just wasn't doing as well as the other one was. So that prompted me to look, and I reached out to the pediatrician, and and this is no fault of their own. It's just something that we're not taught in school. And they wanted me to call ENT, which is ear, nose, and throat. So I called ear, nose, and throat, and they wanted me to call a dentist. So I called the dentist, and then the dentist wanted me to call the ENT. So I was kind of stuck. And some things you learn by research, and some things you learn by experience. And that was an experience that I had where I finally, through a high school friend that was a speech language pathologist, got me connected with one at Marshall Health. And her name's Bryn Brown. She's wonderful if anyone's looking for someone. But so we went through Bryn Brown, and she did a diagnosis and found that he had these restrictive oral tethers, and referred us to a dentist in Lexington. Her name's Dr. Tynan. She's with Serendipity Dental there in Lexington. And we went to see her, and she accommodated us the same day from where we traveled. And within 60 seconds of a procedure, all 4 of his oral tethers were lasered via laser therapy by a dentist who has done probably 10,000 plus of them. And
Wow.
we immediately noticed a difference in him with his overall demeanor, his posture, reflux. He was on medication for reflux after we had this procedure done, in combination with chiropractic therapy with Dr. Cooper with Short Chiropractic in Huntington. He was a completely different baby. He was off his medication in a couple weeks. So it's just about reaching the right people and reaching the right specialists that have this knowledge to get you through the right channels to get things done. And, I did have to go out of the area to get it done, but at least I was led in the right direction that way.
Yes, yes. So I have 2 more questions, and I
Yeah.
do appreciate you spending your time. We had another one. You were talking about postpartum depression
Yeah.
earlier, and this question came in. I really liked it, so I'm going to share it with you. Again, if you have questions, just put them in the comments. If we're not able to get them here on the live stream, maybe Katie will come in and reply to some comments. But this is a good question. Can a dad have postpartum depression?
Absolutely. I've already treated several in the just few weeks that I've been open. It's not just moms that go through the change. It's siblings and children and the fathers, grandparents. I know my parents are really involved, especially since I had twins. Everyone kind of has that life adjustment after a baby's here. Not only has a woman's hormones changed during the last 9 months, but I'm sure the relationship between the husband and wife has also changed. And now the husband's stepping into new roles, or the dad is stepping into new roles. And it's scary, having your first child, or any child, second, third, fourth. There's things that always change. And anytime anyone has a lifestyle change, mental health issues can arise. And I do want to point out that we refer to it as postpartum depression, but it's not always depression that people struggle with. It can be OCD, intrusive thoughts, thoughts of, oh my gosh, what if I drop this baby? We see that as normal, but that's not always the case. And we can help treat that. So anxiety, depression, OCD, anything like that can be a change that people go through after a new baby.
And just knowing, and we never use the word normal, and I'm sure in the healthcare field you don't use the word normal. We use
Very
typical.
rarely.
What is typical in the range? But stuff like checking on the baby constantly,
Right.
may be typical, but it may also be something that you might need some help with because it's diminishing your quality of life by always with the intrusive thoughts going into the other room or baby monitors, security cameras, and the whole thing. So even though that is typical, it still may need to be something maybe you talk about, right?
Right. I mean, there's studies out showing that when women were questioned about having these intrusive thoughts, nearly 100% of them admitted to it. And I can admit to it as a mother. We had concrete floors, and one of the things that I always feared was, oh my gosh, what happens if I drop this baby? And not that that's not a logical thought to have, but it's when those thoughts are interfering with your daily life. You're not able to do things. You don't go out of the house because you're scared that you'll be in a car accident with the baby. All those are really logical and, typical thoughts, but sometimes they do interfere with our well-being and interfere with our daily lives. And in order to be a good mom. You need to be a healthy mom. So no one's going to think,
Nice. Yes.
yeah, no one's going to think any less of you for having these thoughts or these issues, and seeking care for them is, the responsible thing to do for not only you and your child, but it's going to make your postpartum period a lot more enjoyable.
This is wonderful, and I appreciate you taking time to talk with me here today.
Yeah, thanks for
Uh, g- I've got two more questions, and
yeah,
then I'm going to let you get back to your life.
yeah.
Um, let's talk about insurance, primarily stuff like Medicare, Medicaid.
Yeah. So currently, my practice is an all self pay practice. And I know that sounds scary to a lot of people because when we think of self pay in healthcare, we think of astronomical prices. Um, if you go to my website and click on my services page, you'll see that I'm trying to keep my prices very, very fair and very affordable. I am offering some membership options as far as the breastfeeding and postpartum care goes that may make it a little more affordable for people. And, I've had several patients come to me over the last few weeks and say, oh my gosh, my deductible is now $50. Well, that's the cost of my entire visit. Um, I like not having to deal with the insurance companies. They don't dictate the care that I give at this point. If I get busy enough and I am able to open a brick and mortar practice, that may be something I look into just because I know it's going to benefit some people that do have good insurance policies. But the other aspect is that I am also not opted into Medicare and Medicaid. So I cannot legally charge someone for a visit that has Medicare or Medicaid. Eventually, like I said, if I get busy enough, that may be something that I am willing to do. But at this point, I'm only currently accepting self pay. Some insurance companies will allow me to print a super bill off for you with like a diagnosis and visit code, and they will allow you to submit that to them as an out of network provider, and you'll get some reimbursement. But that's just dependent on what specific private insurance company that you have. For people that don't have insurance, this is a fantastic option and way, way, way cheaper than a urgent care visit.
I would encourage anybody to go to the website, take a
Yeah,
look at this at the services. I know they probably didn't come across real good on this tiny screen, but your memberships are fantastic, and I love how you can give as a baby shower gift a membership for talking about lactation and postpartum issues, but then your per visit cost is about what a deductible would be. So
yeah, yeah.
it's very, very affordable and very efficient.
Thank
Uh,
you.
and I like efficiency. Last question on my end, and that is if a new patient decides they want to contact you
Yeah.
and get an appointment, what's what kind of how backed up are you? How soon can you see somebody?
I'm not currently. Currently, I can usually offer a same day visit. You may have to work around my daughter's t-ball schedule or my kids pulling at my feet, but like I said, if I'm spending 15 to 30 minutes with you and you have a need, I always try to work you in when I can. I do have a self schedule option on my website on hours that I know for sure I am available. But I just encourage anyone that has any questions or wants to schedule, you can reach out to me via text, call, Facebook, or I have an email option on my site. Any way to get a hold of me is great, and I'm always willing to work with you on getting you scheduled.
And that website is Kaleigh More Than Just Medicine. And that's your name. Play
Yeah,
on words. I love it. Kaleigh More
thank
Than
you.
Just Medicine .com. So that's where we find you. Is there anything I've left out, or is there anything during our conversation that you want to highlight or circle back around on?
I don't think so. I think we covered most of it. I just want people to know that I'm just here to try to meet some gaps in care needs locally, or this anywhere really, state of Ohio. My heart's always here with Scioto County, but I'm willing to help wherever I can. So
Anywhere in the state of Ohio, or anyone currently physically in the state of Ohio from elsewhere,
Right.
And let's point that part back out, because if you're coming from Florida or Timbuktu or three, and you're visiting, you find yourself with, you're like you say, you don't have any refills left on your blood pressure medicine, or you end up change of scenes gives you the flare ups. Somebody can talk to you right away,
Right. Yeah, and I do
no
want to
matter where.
Yeah, I do want to mention as well, now that Ohio is a compact nursing state, I'm currently working on changing my RN license to a compact license. So as soon as that's done, and I endorse my AANP in Kentucky, I'll be able to make it a little bit more convenient for those patients in Kentucky. That way they're not having to travel across the river for their appointment. So
That's great. And we'll make that announcement when that time comes, I assume, right?
yes, yeah, hopefully very soon.
All right, fantastic. Ladies and gentlemen, this is Kaleigh Moore, and please go to her website, Kaleigh More Than Just Medicine, or you can give her a text. Let's throw that back up one last time here. Shoot her a text, and you're on all the social medias. We appreciate the folks that commented during the live stream. Anybody else, Kaleigh will go back and reply in the comments. Thank you so very much. I think you are doing a wonderful, wonderful thing. Wish you all the best in your business.
Thank you. Thanks, guys,
And
for having me.
oh, it's my pleasure. All right, folks. Next time, we're number one for a reason, and that reason is you.